Our names are Anne-Marie,
Grace, Linda,
and Levi.
We are a part of the Eastland Pre Dental program, and today we are here to talk to you about placing anterior and posterior x-rays and using the paralleling technique. Before we get to talking about x-rays, it's very important to mention that we need to wear PPEs whenever dealing with a live patient. PPEs when taking x-rays include the following: gloves, N95 mask, lab coat, glasses, and finally an x-ray monitor badge.
After putting on your PPEs, turn on the x-ray machine.
Before continuing any farther, open your digital patient file management system and select the patient that you are taking x-rays on. For this purpose, we're going to use a full series mount. Critical/safety precautions. Put the lead apron on the patient. This helps to protect the thyroid, condyles, and reproductive organs. Lead is very dense and protects the patient from overexposure of radiation. After putting the lead apron with a thyroid collar on the patient, describe the procedure to the patient and encourage them to stay still, but keep breathing. This is ideal to have the patient close their eyes when taking a radiograph. Select the correct mount window.
Different ring rings perform different jobs. You can tell which job one performs by the color they are. The yellow ones are used for posterior periapicals, and there are two, one for the upper right and lower left, and one for the lower right and upper left. The red one is used for bite wings. The blue one is used for anterior periapicals. Some common errors are overlapping, foreshortening, and elongation. To start, overlapping is when horizontal angulation is not properly aligned. To fix this, reassess the horizontal angulation and make sure that the central ray is directed through the interproximals. This common error happens when the tube head is placed vertically too high. To fix this, lower the vertical angulation. Elongation happens when the tube head is vertically placed too low. To fix this, increase vertical angulation.
The sensors slide into a pocket in the rings. Be sure the cord is not in the path of the x-ray beam. Make sure the sensor is centered in the ring and with the PID when placed in the
sensor ready.
Make sure to press the button straight on and hold until the chirping stops. If you release the finger before the chirp stops, an error code will result. Check the timer and exposure settings of the X-ray control panel. Push the button on the control panel. Timer and exposure settings or selection criteria is when each patient is put into consideration when taking x-rays by adjusting settings on the control panel.
To wrap up x-rays, remove the ring rings and sensor from the patient's mouth. Save the x-rays in the patient's file. And make sure to sign out of the computer. Finally, That, my future dental assistants, is how you take and correct x-rays. Thanks for watching, and we hope our info helps. Bye.